Kia ora koutou, bula vinaka and warm Pacific greetings to our Heart Help Live session. We do apologise for the delayed start. We have been having a few technical difficulties. My name's Leonie. I'm a heart nurse here at the Heart Foundation. Over the next few months, we're celebrating Pacific Language Weeks and supporting them by encouraging everyone to learn a phrase in a Pacific language. We also acknowledge that today is World Hypertension Day. Untreated high blood pressure can lead to heart disease, so it's really important to get regular blood pressure checks, especially as you get older. This month we're also focusing on women's heart health, and to acknowledge this we have some amazing storytellers joining us this evening. With me are Anna Couples and Becky Giblin, who will be sharing their stories. Miriana Hona was also meant to join us, but sadly is unable to attend, and she sends her apologies. Miriana has a powerful story to share, and you can watch her video on our website. We'll share the video link in the chat. Before we start, it's important to note that the session is not intended as a substitute for professional medical advice, diagnosis, or treatment. If you have specific questions about your condition, contact your healthcare provider. Our storytellers will be sharing their personal experiences and views, not those of the Heart Foundation. First, we're talking to Anna Couples, who in 2016 had a spontaneous coronary artery dissection, otherwise known as a SCAD, which is a type of heart attack caused by a tear in the coronary artery. Kia ora, Anna, and welcome. Would you like to tell us a little bit about yourself?
Thank you, Leonie, and kia ora, everyone. My name is Anna, and I was 36 at the time I had the SCAD. I'm now 43. I'm a software developer or software engineer by trade, but I'm in engineering management for a tech company.
Oh, fantastic. Thank you, Anna. Do you want to give us a little bit of an overview about what happened when you had the SCAD, your recovery, and just the sort of things that you went through at the time of the event?
Sure. Well, some of you may have read my heart journey online. Just for a bit of context, I was super fit. I was an Ironman triathlete, so I did a lot of training, and I had, I think, been in hospital twice in the 36 years prior to my SCAD, for getting my tonsils out when I was 12, and for a bike crash where I hurt my elbow.
Sure.
So at the time of the SCAD, I had stepped back a little from really intense triathlon, but I still worked out every day, went to the gym, went running. And it was a morning where I went for a run with some people from work. We jogged to the Domain and we were throwing around a frisbee. And I felt this tightness, a tightness very central in my chest, and it actually felt like my sports bra was too tight. And so I actually went and I took it off, and then we were playing. I did have another top over the top.
Yeah, sure.
And we were playing ultimate frisbee, so running around at that point, and I had to keep subbing off the field as I was getting very out of breath, which was quite unlike me. So at that point, I thought, I'll probably just take a break and head back to work. And so I said goodbye to everyone, and I went up the path, and I was at the point where I could go left to go back to work or go right to go to the hospital. And I thought surely I couldn't be having, a heart issue.
Yeah, absolutely.
And I also felt like I didn't want to look silly walking into the ED. So I went back, which I know is something we don't recommend. So I went back to work. I had my breakfast. I had my shower. I started working, and I still felt the central tightness and a bit of heaviness in my arm.
And so it was more a tightness rather than a sharp pain or anything like that?
Yes, certainly not sharp pain, not debilitating, but a weird feeling.
And for a lot of women, who have a heart event like a heart attack or a SCAD, it can feel like that constriction across the chest rather than that sharp pain that is often used as a description for a heart attack event happening. So interesting to note that that was the experience that you had. Yes. So you got home, you started a little bit of work, and
yes, I got back to the office. I was still then feeling the tightness. So I actually called my sister, who's a nurse, and said, what do you think I should do? I ended up going to the GP, and they did an ECG, and that all turned up fine. Everything looked fine. But he did say at the time, we'll just do a blood test just in case, put me on urgent. So I went and did the blood test, went back to work, and then the pain had gone away. And so I carried on with my day. He gave me a call a couple of hours later and said, "How are you feeling?" I said, "I'm fine." And he said, "You're not."
Quite a scary phone call.
Quite shocking. So the blood test had shown up an elevated troponin level, which is the enzyme that's released when your heart has some damage.
Yep, excellent. And so when it's elevated, it indicates that there is some heart muscle damage that's occurring. And the advice at the time was to
go straight to the ED. Yes. So I did. I spent a couple of days or a couple of nights in Auckland Hospital and had an angiogram when they confirmed the SCAD.
And so that, just to help clarify for people who are watching, it wasn't a blockage or anything like that had caused your heart attack. It was a SCAD event, which is basically, as we described, a spontaneous dissection of the artery, a little breakage in the artery wall. And so
the way it was described to me is the innermost lining of the artery tears, which causes a flap, which causes the blockage.
So the artery itself is not open, it's just that of the layers, that most inner layer that has caused a little tear. And so how did they treat or manage that?
So SCAD is something there's not a lot known about it. It's quite uncommon, but the treatment has moved along, as more people have suffered from it. And so they did not put in a stent because sometimes that can tear the flap further. It was medically managed. So I went on some medications at the time and then was told to rest, which I'm not too good for that.
Not as a previous triathlete, no.
But I did follow the doctor's orders.
Excellent. I'm glad to hear that.
And actually that was probably the hardest thing in the recovery, was the mental side of it. Going from someone who could do anything, I love to push my body to the limit and do high intensity training and long training, and then to go to a point where I didn't really know what my body could do. As I said, there's not a lot of research, so there's not a lot known about what causes them.
I mean, even some health professionals, some doctors and things like that, it's very little understood or misunderstood type condition that even clinicians have not heard of it in the past. We've had callers come through to the Heart Foundation and their GP doesn't even know what they're talking about when they've said they've been diagnosed with a SCAD event. So
yes, I've encountered that a couple of times.
I'm sure.
I'm quite good at describing it.
Well, you've done a great job tonight.
Thank you. So yes, the mental side of it in the recovery there was probably the hardest. And knowing when to be able to get back into exercise.
And so with that sort of recovery, I'm sure there would have been a lot of anxiety. Were you experiencing symptoms still post-event? Do you want to sort of tell us a little bit about that?
Yes. One of the biggest pieces of advice on discharge was, if you have similar pains, come straight back. And what my brain automatically did was overanalyze every little chest pain. I actually started, instead of feeling stress in my neck and shoulders, I would feel it in my chest. So yes, I did go back to the hospital within, I think it was about 48 hours, which I believe is quite common in these cases. Yes.
And at the time when you went back into the hospital, did they just give some reassurance, or did they do further investigations?
Oh gosh, it was a while ago now. I don't remember. I'm sure they would have taken bloods.
Just to make sure
bloods to check.
Troponin rise wasn't happening again.
Yes, and probably some monitoring. As every time you go into the ED with a heart issue, straight on the monitors. Yes.
And so you talked about the fact that you weren't able to do as much activity. You were told to slow down. Given that you were so athletic, so involved in sports, did the fact that your activity level was decreased impact your mental health at all? Because we know activity is really good for mental health. So by having to reduce it, how was that impact on your recovery as well? Yes.
It was definitely, because it was such a big part of my life. It was a huge part of my life that was taken away. And I know Becky previously has talked about and will about the loss of identity, and I can really relate to that with losing this big piece of what was me. And I'm sure some of that was also the physiological side effects or good effects, benefits,
Yeah.
benefits of exercise and that on the mental health as well. Yes.
Was there anything you were advised not to do, or there was caution around what you should be doing? Would you like to talk a little bit about that?
Yes, it really, as I said, it's not really known how much you can do. So I was advised to listen to my body, number one, and probably not be out in the middle of the ocean, which you often do when you're training for an Ironman, or be way out in the middle of the country on your bike, which again you often do when you're training for long distance races. So it was more about be safe and listen to your body.
And then I know you also have talked a little bit about your desire to start a family as well. Did you want to share about that at all, or? Yes.
Immediately after the SCAD diagnosis, of course, in the lack of information, you do go to the internet, and I found a SCAD group out of the US, and there was a lot of scary stuff to read on there about not having children after a SCAD, because one of the potential triggers for a SCAD is thought to be hormonal changes, and there is a high proportion of people who have them postpartum. So there was some research that the cardiologist actually, who was sponsored by the Heart Foundation, found and shared with me, and so basically they said, yes, you can go ahead with that. We will put you under monitoring. And I actually went ahead and had a very healthy pregnancy and a very healthy birth, and I have a lovely daughter.
Oh, that's fantastic to hear. How old is your daughter now?
She is 6.5.
Oh, full of energy.
Yes.
Oh, that's awesome. Yeah, no, I think for many women, because women do tend to be most impacted by SCAD events, especially in the younger age bracket, it can be quite scary, especially if you haven't, had a family yet, if you, have been a high-level athlete and you're having to stop the activities that you're doing. So it's really great that you've been able to come and share your story. So thank you for that. Just before we move on to Becky and her story, do you have any comments about support groups or people in your life who supported you in your recovery period? Do you have any comments around that side of things?
Yes, I mean, I have a wonderful family who are very supportive, and we're very close. So I was lucky there that I always had people to visit me. Also, two of my siblings are health professionals, so that helped. There is a SCAD Survivors New Zealand group, which has been really helpful, and I hope that I've been able to give back there too when new people join and we can share stories. Everyone has similar feelings, particularly at the beginning. You wonder, am I ever going to feel normal again? Am I ever going to not have this anxiety or these problems? And so just sharing that over time, that does get better. And just sharing common questions as well.
And one final question. Are you still on any medication 7 years post-event?
I'm not.
No? So you were able to come off all your medication. How long did you stay on medication for?
Actually not very long. I think after only 3 months, I pretty much came off everything except aspirin, and I was on aspirin for a couple of years, a very low dose.
Yeah, and that's the difference between a heart attack caused by SCAD versus a heart attack that might be caused by a plaque rupture. If it's a plaque rupture and you're on medication, you actually need to stay on that lifelong for a majority of people, or an extended period of time, whereas a SCAD event is not caused by a rupture of plaque, and so you don't need that medication for as long a period. So well, thank you, Anna, for sharing your story with us. It's really interesting to hear the experience that you've had, and it's great to see you here looking so happy and healthy. 2 H's. So we're going to move on to our next storyteller, and we will come back to you with some audience questions towards the end of this session. If you do have a question for Anna, please put it in the comments section. We're now going to meet our second guest, Becky Giblin, who at the age of 22 was diagnosed with cardiomyopathy and heart failure, which basically meant her heart muscle wasn't pumping properly. Bula, Becky, would you like to introduce yourself and just let us know who you are?
Sure. So my name, as you've said, is Becky Giblin, and I work in the medtech space as well, but in the administrative side. And I, like you said, was diagnosed at 22 years old, and I'm now a few years down the line. I'm 28 now, and it was quite a life-changing experience for someone my age to suddenly have her world turned upside down like that.
Absolutely, 22. I mean, that's really young and really fairly uncommon actually to have a diagnosis of heart failure. So to have it at such a young age, there must have been a precipitating type cause, and I understand that you had a virus and hypothyroidism.
Yeah.
Are you able to tell us your story and just share what you went through at the time and where you're at now as well?
Absolutely. And I think it's important to note that 2017 was terrible, firstly, for me, but I actually started the year with a very bad head injury, which is where they picked up the hypothyroidism. I fell off the back of a golf cart. I had some internal bleeding, which led to a seizure and a number of other complications. But because of that, we picked up the hypothyroidism. And so I was slowly being treated for that and on a lot of medication and slightly immunocompromised when the virus then kicked in. Normal flu, didn't think anything of it. But it was recovering from that I started to notice I had some trouble breathing. And it was dismissed. It was thought, oh, it's just your asthma coming back. And then in the space of 24 hours, I suddenly couldn't walk up the stairs in my own home. I couldn't breathe. I felt like I was drowning. If I lay past sort of that angle, I felt like I had somebody sitting on top of my chest. And
so how soon after your head injury did you start to, did you get the virus and start to notice these shortness of breath type symptoms?
so head injury was end of Feb, beginning of March was seizure, and it was August when I had ended up in hospital, so it would have been late
3-4 months.
Yeah.
So quite a short turnaround time. And so you're getting the shortness of breath, you're finding it really hard to walk upstairs, lying flat was difficult for you. What were the next steps? What did you do next? Because you weren't living in New Zealand at the time, were you?
No, I'd been working in Fiji and staying with family, and I got on a plane and came back to see my GP here in New Zealand. And he'd known me my whole life, and he immediately picked up. I think he spent 5 minutes having a conversation with me and then sat me down and said, we're going to do an ECG, we're going to do some bloods, we're going to go home, pack a bag and go to hospital.
That's pretty scary to hear that. Yeah.
And I ended up spending the next 3 weeks making really good friends with the nurses and doctors at the North Shore Hospital.
Wow. And so you were admitted up to hospital, but at this point in time you still didn't know what was actually happening, did you?
No, and I didn't for I think it was about 3 days of playing hide and seek with my family as I was moved around the hospital into different wards. I went from being admitted into ED and monitored, and then moved into the high dependency unit, CCU, and so by the time I got to CCU I had a diagnosis.
So CCU, the cardiac care unit, just to get the acronym out there.
But sitting in, I think it was about 11 o'clock at night by the time they moved me into the high dependency unit. And when you're 22 and clearly the youngest person in there, strapped into machines to help you breathe, and watching a group of specialists surrounding the end of your bed having a serious conversation that you can't hear because of the machine pump helping you to breathe, it's a very terrifying and sort of
overwhelming, and
just it really hit home that, oh, this is serious.
And you didn't have, at that particular time, you didn't have, I mean, your parents were here, but they weren't actually physically with you in the hospital, were they?
So they'd gone home for the night, and I was sitting there watching these people and sitting there by myself and waiting to hear what was going to be next for me.
And so at what point were you actually diagnosed with cardiomyopathy?
So it was
and heart failure? Sorry, 3 days in?
3 days in.
Yep.
They came and sat me down and talked to my mom and I, and basically said that I was suffering from heart failure. They told me that I was going to potentially be in line for a heart transplant.
Oh, wow.
And that I needed to stay in hospital. I wasn't going to be allowed to go anywhere for a while. And from there it was 3 weeks of sitting and waiting in limbo.
And so over those 3 weeks where you're sitting and waiting, you sort of didn't know what was happening. Were you given medications to treat your condition?
Yep, so I was immediately put onto medication, which helped with, firstly, clearing out fluid, because I had a whole lot of fluid built up around my chest. And so I came into hospital looking quite weird. I had a very distended rib cage. It was pushing me out quite a bit. And that was the reason that I couldn't breathe.
Right.
So
the distended, that's fluid retention that we're talking about here, and so that was putting pressure on your lungs, which means they weren't able to inflate, and it was causing the difficulty breathing. Yeah.
And so getting rid of that was the first start. I think I also completely lost my sense of taste with all the medication I was on. I'd had trouble after the head injury, but completely lost my sense of taste, and so in a week I lost 7 kilos in hospital.
Oh wow, that's a lot in a short period of time.
And a lot of that was the fluid.
And so with the heart failure, we often know how severe it is depending on your ejection fraction, and this is a number or a measurement that is used to tell us how effectively and efficiently your blood is being pumped around your body. Were you given a number in terms of your ejection fraction?
So it took a little while. I had to be able to breathe for them to put me into an MRI to get that number and get a bit of a clearer image of what was going on.
So you could hold your breath?
Yes.
If you can't breathe, you can't hold your breath.
But I think it was the 2-week point we got the number, and it was 13%.
13%.
1-3.
Yeah. And so a normal ejection fraction for a healthy adult with no cardiac history whatsoever would be around 50%, 45 to 55%. So the fact that yours was down at 13%, significant, indicates significant impact on your quality of life, on your ability to breathe, to function, your heart to pump effectively. And so you're in hospital for the 3 weeks. There was talk about pacemakers. There was talk about heart transplants. You were discharged home. Did you end up having any of those procedures?
No, I was incredibly lucky. I responded very well to medication, and I think that's a real testament to the fact that I was young and I was living a healthy life to begin with. I wasn't a smoker or anything. I was in a very good place to change my life and my habits, and I had a fantastic family that was around to support me through all of those changes. And so I responded very well to medication, and I quite quickly got to the 30% mark, which put me into being ineligible for the ICDs and everything else that was being considered at that time. And so I've certainly had drops, and that's come up and down. I didn't have any heart surgery or anything, but I did have 2 doses of radioactive iodine to deal with the hypothyroidism.
And so that would also have impacted on your heart and helped to ensure your heart was functioning at its best ability. Have there been any times, it's been 6 years now since your diagnosis?
6 years on the 8th of August.
On the 8th of August. That's probably a date that's seared into your memory. So, you're here, you're talking with us, which is fantastic. And I'm sure it's not been the easiest of roads over the last 6 years. Heart failure is a diagnosis that is lifelong. You're going to have to live with this condition for the rest of your life. At the age of 22 to get this diagnosis, I'm sure that's been a bit of a minefield for you. Sort of just accepting that. Would you like to talk a little bit about how that's impacted you?
Absolutely. I think when you're 22 and you suddenly realize that your heart isn't working, and that's something that you can depend on, right? You always you never think about it until it's a problem. And to suddenly go from being a very independent person who wanted to do a lot of things to being told that I couldn't go back to work, I couldn't walk up the stairs, I couldn't do some of the things that were really basic to me. It was a true loss of identity, and it was really coming to terms with the fact that at 22 I was starting my life again and relearning how to be a self-sufficient adult. And I was really lucky to have the support unit that I did, and I don't think I could have gotten through it without their constant support and reassurance that I wasn't alone. But it is incredibly lonely. You're significantly younger than most other people going through the same things. So the closest person to my age in hospital was 44. I was 22. Everybody else was in their 60s, 70s, and 80s.
And support groups are probably, will reflect the fact that it is frequently diagnosed as you get older, rather than, I mean, obviously it impacts younger people as well, but not as it's not as prevalent in your
No.
20s and 30s as you get older. So
Yeah, finding a support unit was a challenge, but it is something that you can do, especially even if they aren't targeted towards your exact condition. And I found that by leaning into the support groups for people who suffer from invisible illnesses, it helped to find that tribe, because we may not have the same conditions, but we're struggling with the same things. We get asked the same questions. I was offered a mobility pass for my car. I didn't take it, but I've since been called out with another friend who's had an invisible illness, and we were stopped and abused for using a disability part, and she was recovering from cancer and I had heart failure, and we looked completely well and normal, and nobody ever expects that. And when we turned around to have that conversation, I think that person left feeling very bad. But it was maybe a learning curve for them to not call out people quite so viciously. But it was finding a group of people who could understand the fear that comes with sitting alone waiting for a diagnosis, the frustration that comes with the healthcare in different parts of the world, and the fear that comes with traveling, or whether or not you're going to be strong enough to do something. I'm 28. The question of whether or not I'll be strong enough to have children or do different things with my life is very much prevalent on my mind.
Yeah, I can imagine. And one of the things that you've talked about is reaching out. And so in terms of your mental health, it sounds like it was a really proactive thing for you to help your mental health, to get that sort of wraparound support. But it happened after you actually had the event. So were you able to sort of tell who your friends were and weren't during the time of it? Or
Absolutely. If you ever are worried about your friend circle and who's actually on your team, heart failure really clears that up, because the people who stick around are the ones who are sticking around because they truly care. Because it's hard to watch someone you care about in pain or struggle and be completely helpless. It's terrifying. And so if you aren't capable of taking that on, it's really easy to step away from that. And it's hard and it's sad, but I think I've ended up in a space where I was really lucky to find people who were going to be my tribe. And I was offered very early in, when I went through the crisis of losing my ability to work, I was offered mental health support. And I actually turned it down at the time. I thanked my cardiology nurse, but I didn't feel like I needed it. And I threw myself into volunteer work instead.
Sure.
And kept busy. And my Rotary and Rotaract family really became a family, because they gave me a sense of purpose back to my life when I was really struggling with that. But 5 years into the journey, and I finally hit a point where my symptoms were coming up so much. My endometriosis symptoms, which is another condition I have, were combating against each other and causing multiple problems, and it was impacting my ability to work, and my self-identity again came back around. And so I was able to access that again through the support with my medical professionals here, and I was incredibly grateful for it.
That's wonderful to hear.
Just to know that I was in a space where somebody would come and help me when I raised a white flag, because it can be really hard to put that white flag up and say, this is too much for me. But when you do, the people who show up are incredible.
And I think it's important to acknowledge, like, while you need support, the supporters, so your supporters, are probably feeling quite overwhelmed as well in regards to supporting you. Were there things, I guess there's two questions here. The first one is, were there things that you were told that you wish you weren't told when you were in your recovery phase, in the immediate recovery phase? And also in regards to your supporters, was there a place that they could go to get support as well?
I think knowing the right thing to say to somebody whose life has completely turned upside down is really, really hard. And I think the reality is, sometimes ask the question. Don't assume you know what the best thing to say is. I've been told that this was God's plan for me. I've been given countless amounts of unsolicited medical advice from people who have the best of intentions, but they're giving you advice based on their own lived experience, and that's not necessarily what I'm going through.
You become an expert in your own condition, don't you?
Yeah.
You know, as someone who's walking exactly the same path
Yeah.
might still not have the same experience because you're the expert in you.
Yeah.
Yeah.
And I think Anna said it really well when she said, doctors will tell you that you know your own body better than anyone else.
Yeah.
That was their response to me when I did the 11 kilometers of the Auckland City Marathon. That was
fantastic.
me getting told when I signed myself out of hospital after having food poisoning to get on a plane 5 hours later and fly to the States for a conference.
Sure.
It's me and knowing my body. But to come back to your other question,
Yeah.
you mentioned support for
Supporters.
support.
Yeah.
It is the most important thing that I can say to somebody who is in that support role, is to find places and people that will support you as well. Being a supporter for someone with any sort of chronic illness or pain or life-threatening condition is incredibly hard and emotionally draining. And so to know that you have a safe place to go to be heard, to talk about what you're going through,
To vent.
absolutely to vent. We're not all easy patients, and I take my hat off entirely to my parents for putting up with me when I am in so much pain that I can't communicate what I need.
Yeah.
But they just sit with me and hold my hands, and sometimes that's all you really need, is to know that you're not alone.
Yeah. And then they in turn go off and find their support to ensure they've got the
Yeah.
energy to give that to you when you need it as well. So
Yeah. You can't pour from an empty cup.
yeah. Oh, well, thank you for sharing that story, Becky. We're going to welcome back Anna now. So welcome back in, Anna.
Sorry, everyone.
No
Coughing
problem at
fit
all.
at the worst time.
That's fine. And so we are going to open up our session to viewers. Our session now for questions from viewers. And I guess this question is for both of you, both Becky and Anna. In hindsight, prior to your diagnosis, was there any signs that something was off? Anna, maybe you'd like to start with answering that one.
Sure.
Yeah.
Absolutely no signs at all. And sometimes I wonder, it would have been quite easy in a way for me to ignore all the signs. You know, I didn't go into cardiac arrest. Plenty of people do. But I could have ignored that and carried on with my life. I don't
Especially
know.
as the pain went away after a few hours.
I don't know what would have happened. But no, nothing leading up. If I was to try to guess what the trigger might have been, it might have been stress, but we all have stressful times in our lives. So no, nothing physical that suggested anything was off for me.
Yeah, until it actually happened at the
Yes,
time.
yeah.
And Becky, how about you? I mean, obviously your story's a little bit different. You've had a few precipitating factors.
Yes.
But prior to your head injury, were there any signs prior to the virus that you had? Were there any signs?
No, so it really wasn't until after the virus that the breathlessness set in. And I think one of the biggest things for me was that all of the symptoms I was experiencing could be explained away in really easy things. And I know that if I hadn't paid attention to them, I wouldn't be here today. My doctors are very candid about that. 13% and in a plane is not something that anyone should be doing.
Yeah.
So, but that breathlessness and the awkward weight gain around my ribs.
Yeah.
And so it wouldn't have even been noticeable if you didn't know me well. But my GP did know me well, and so he could see it very easily that I was out of proportion.
Yeah. So in a way, advocating for your healthcare, you know, advocating, knowing that there's something wrong that's happening inside of you, and you know, making sure you're reaching out, getting help that you need. And if you get turned away one avenue and you're still not sure that that was the right choice, going back and asking again, or going to someone else to get a second opinion. Yeah. Fantastic. So we have a question now for you, Becky, from Larissa. Do you have any ideas on how to tell family and friends about your diagnosis or about a diagnosis like this? Larissa has mentioned that she finds it hard to talk to people who don't understand. So do you have any suggestions for Larissa regarding this?
I don't know if I would have suggestions on how to tell your family and friends, except to just be honest. Be honest about what you're going through. Be honest about what you're feeling. because at the end of the day, it is your diagnosis and it's your story, and this is the beginning of your journey with your diagnosis. So asking and setting the scene for them to create a space that you feel safe to have the conversation in, because when you're talking to people who don't understand, they may never understand, but they may find a way to support you anyway. And so taking the time to explain as much as you need to and as much as you feel comfortable to, but remember that you don't really owe anybody an explanation for what you're going through. It's your story and your journey.
Oh, that's great advice. Thank you, Becky. And so, Anna, we've got a question here from Kieran. How did you know when you were ready to go back to work and exercise after your event? That's a great question, Kieran. That's a really good question.
It's a great one, and it is really hard to know.
Yeah.
I didn't, I think I mentioned before that I didn't feel unwell. I was told to rest, and with me, when I rest, I feel great, I wouldn't say it was obvious. I just took really small steps getting back into things, go for a walk, see how that feels, listen to your body, maybe try a little bit more the next day, building up, yes. Yep. I didn't do anything significant until I'd had my cardiology follow-up appointment, because as I mentioned, there wasn't a lot of research. I didn't really know how much I could do. I was just told to rest, so to try to follow those orders as much as possible. At the time we were actually having some landscaping done, so I sort of sat at the window and watched the diggers and things.
Project managed maybe a little bit.
Tried not to.
Tried not to.
So Karen, I think it was a combination of listening to my body and taking it slowly. I think the doctor might have prescribed when I could go back to work. They had said, given me a period of time. Yeah.
And I think, to be honest, that's common with a lot of cardiac conditions, is in terms of the recovery after you're past the acute phase, you're on the management side of things, it's listening to yourself, taking it slowly, small steps, building up over a period of weeks rather than hours or days, rather than trying to do too much too soon, because you do risk a relapse, or you risk pushing yourself too hard, which will actually slow your recovery down a lot of the time if you do push too hard too early. So thank you for that, Anna. So our next question is for both of you, and I think you've actually both touched on this a little bit through your telling us your stories, but have you found any support groups useful both online or in person? Anna, you mentioned the Facebook page, the US and the New Zealand one.
Yes, certainly the New Zealand one, I would say. And also, I know that ADHB does run some groups for SCAD, and there's another similar,
Takotsubo.
Takotsubo. Very similar.
Yes. You put me on the spot. Sorry, it's okay.
I knew it was a hard word to say no matter what, even if you do know it. Have run some in-person groups as well. That was pre-COVID, and they were useful. Just to, if nothing else, I think anything where you feel you're a minority. In my case, SCAD is not that common. In your case, you're a young person. You can feel very isolated, and just connecting with someone who has had a similar experience, even if not the same, can help with that feeling of inclusion or just less isolation.
And Becky, do you have anything to add? You've talked about Rotary being quite a significant support, but in particular to the heart failure, have you found any support groups of other young people who've had a similar experience to you?
So I've not found any that is specific to heart failure, but I've found a number of invisible illness groups that are mainly run online from around the world. There's one run by a girl named Lala, so I think it's called Chronically Ill Lala. And she does a weekly Zoom session with people from lots of different, who have lots of different conditions from all over the world, who come together and we essentially just talk. I don't go all the time, but sometimes when I feel like I need to connect with someone who can relate to what it feels like to wanting to be really present at something, but knowing I'm not strong enough for it. If I'm having a low day, it's somewhere that I can go and have a safe space to talk about what I'm going through. And I think sometimes, honestly, it's easier to talk to someone who doesn't know what you're going through. And I think about that a lot when I combine my friend groups, honestly, because I have my pre-heart condition friend groups and I have my post-heart condition friend groups. And I think when they come together, sometimes they struggle to, my pre-heart condition friend groups struggle to align the person that I am now with the person that I was. And especially if they weren't there for that change in identity that I went through.
And then the post-heart condition friend group only know you as you are now, and so they never knew you before the event happened. So that was an online support group. I know there are some face-to-face support groups around New Zealand as well, but they do tend to be, as we've already discussed, more for people who are older or you know, sort of a little bit outside what's happened to you and your experience, isn't it? So yeah. Our next question is from Cheryl, and this is for you, Anna. She writes, since my heart event, I've been very anxious about it happening again. Do you have any tips on handling anxiety after a heart event?
Oh, that is real, and I don't think there's a person who's gone through a heart event who doesn't have anxiety about something happening again. And there is some research on SCAD that it can recur in you know, a certain percentage of people. Oh, tips on anxiety. The first one I would say is time. You know, once more, I know that's not super helpful because you can't accelerate that, but once time has gone on, it has become less of a all-consuming, or even less of consuming any of my brain space. I think talking before about that loss of identity or loss of exercise or loss of whatever is finding something to fill it, and I think you had talked about that. It gives you, it's almost like a distraction or something else to focus on, you know, rather than giving yourself too much space to be anxious about it. Those are the only tips that I have from my experience.
If would you say, and this might not have been for you, but if someone is really struggling with anxiety, you know, would you recommend they reach out for help? And
certainly if they feel comfortable doing that. I did use at one point an employee assistance program. You know, a lot of companies have those, and that's great because it's free and it's impartial advice and it's just someone to talk to, and you do get to speak to experts. So that can certainly help. Or speaking to people with similar experiences. Although for some people that could actually, you know, make you think more about it. And I was going to say with time, you know, you talked about time being quite a significant factor. The longer you go without having an event, the more relaxed you become, would you say? So, I mean, it's been 7 years for you now. Are you, I mean, I guess it still plays on the back of your mind a little bit, but you're able to live life normally. You don't restrict yourself in any way, would you say? Or no, I think so correct. I don't really. I certainly don't do what I did before. I don't do really high intensity training where I'm pushing myself to that upper threshold of my heart rate, which I used to love.
I would say that's a fairly small proportion of the population which you do that in the first place, though.
maybe. But talking about restrictions, I do restrict myself there. Other than that, no, just trying to, you know, stay healthy and don't do anything that could potentially, you know, trigger one. Not that we really know what could trigger it.
Exactly. That's great. Our next question is, do either of you have any tips or on questions to ask your doctor after getting diagnosed? And Becky, maybe you'd like to...
I think one of the first things that I needed was more information. And that's not always something that doctors, especially specialists, can have time to sit down and walk you through everything. And I think asking your doctor where to go to for the right advice, because there is a lot of white noise out there. There's a lot of information that comes at you very, very fast. So taking the time to find the right resources, asking for those support groups, asking for tips on everything from nutrition to medication options. And I think in the early stages of getting diagnosed, it can be really scary to do that. But you will find that you have quite a bit of time on your hands if you're getting told to rest. So sometimes there's room to learn.
A little plug right here, but how did you find the Heart Foundation resources? Did you have access to them after you were diagnosed?
I did, and it was I did look into it, and it was a little while later before I actually contacted the Heart Foundation and went through the journey story process. But I got support, but it was also flagged, you are significantly younger than our last group that was doing anything.
Yeah.
And so I chose to find support in other spaces.
As well? Yeah. Absolutely. Yeah. And I think it's good to have that wraparound rather than just rely on one area for support. It's good to have multiple avenues there. Yeah.
What I would say on the tips about what questions to ask your doctor, this is less about what questions, but I found I had so many questions, and then you get a limited period of time with the doctor. You need to write them down.
That's a really, really good tip, absolutely.
And actually, my family would have a lot of questions too, so write them down because, they're not in the thick of it. They can sometimes think a little straighter.
Yeah.
Writing them down and getting the answers.
And taking someone with you to your appointment as well, because, we know that retention of what you're told is, especially if it's quite an emotionally based conversation, you don't always retain all the information. So having someone there with you to sort of advocate on your behalf or to ask some of the questions or just help you remember what you're told.
Yeah.
Did either of you use that avenue at all? Did you take a support person with appointments? And
so I did. I had my mom with me, and she was fantastic, and she actually stopped her entire life and came to live with me here in New Zealand because she's really wonderful like that. But I also had a notebook that I built, and you've just reminded me of it. I haven't looked at it in a few years, but it had a whole bunch of different sections, and I had medical questions. I was finding, the clinic letters that were coming out. It was the medications I was on, because all of that is so overwhelming. The different medications that I was getting cycled through and times to take them. So I wrote everything down, and I wrote a journal while I was in hospital too, and I still have it. I kept writing in it for sort of 6 months and filled an entire book. It's the only time in my life I've finished a journal, but I definitely think that having that information in one place made my life a lot easier.
And writing it down, did it help you process
Absolutely.
As well? Yeah.
Absolutely. And so I wasn't seeing a therapist or anything at the time, but I wrote from every experience, and I can still see myself sitting in HDU writing, looking out the window going, I feel like this window looks exactly like the plane window I was just looking out of a couple of days ago, and now I have no idea if I will ever get home and see that view again. And so there was a lot of emotional processing that went in behind that writing.
So just to remind people, HDU stands for the High Dependency Unit at the hospital. Yeah. Our next question, if you could travel back in time and tell yourself one thing on the day of diagnosis, the day you got told you had your condition, what would it be? Traveling back in time and tell yourself one thing is maybe it's going to be all right, or... Yeah.
I'd love to say it's going to be all right.
It's a thought-provoking question.
It sure is. What a great one.
Yeah.
I think I would have to say that there is going to be a life on the other side of this diagnosis, and it's going to look very, very different from everything that I had ever planned out for myself and where I thought I would go. But I can honestly say that the challenges that I faced put me in situations that took me on a very different path that I do more now than I ever could have imagined I would have before my condition. So there is a life on the other side of it.
Nice.
That's awesome. And were you able to think of anything on the spot?
I think the obvious one
We're
is...
really on the spot, but
you will be okay.
Yeah. It's just reminding yourself that, because it can be so overwhelming to hear it in that moment, and to think about what the next day might even hold, let alone the future. So, Well, thank you both for sharing your stories and for helping answer the questions from our viewers. This brings our Q&A session to an end. Thanks to everyone who's participated in today. including our incredible speakers. It's really been an honour to hear their stories, and as I said, thank you for sharing. To everyone who's been watching, you've asked some really awesome questions, and we hope you've got a lot out of the session. If you want to hear more of people's heart stories, you can visit our personal stories section on the Heart Foundation website. We'll post the link in the comments. We hope you found this session useful. We really value your opinion, and we'll be grateful if you take a few minutes to fill out our survey that's posted in the comments. Goodbye, good night, and we'll see you at our next one next month.